My name is Leslie. I'm a registered nurse. Worked for the UMass Memorial System since '05, primarily in obstetrics and gynecology, most recently in the PACU. I'm also a forensic nurse for the Mass Department of Public Health.
So today we're talking about Ramona T. Mercer, and she has a theory about maternal role attainment in dealing with mother and child and mother and father in that dynamic. Can you think of a story, or can you go back into your career and talk about an area in which you were able to use Ramona's theory in your practice?
Yes. So I was working with a mom who was actually very young. She was a teaching assistant. She was about 19, who had gone to her doctors for her routine check. She had a what we call a family practice doctor, so she wasn't seen by a direct OBGYN. That in turn, when she went, her blood pressure was very high. They rechecked it, it was even higher. Her anxiety level started going up. They dipped her for some protein in her urine. They found out her protein was high, and they immediately sent her to the hospital to be checked in, to be evaluated by an actual OB. When she came to me, her anxiety level was through the roof. She was out of control. She couldn't be calmed down. She was very nervous. She wasn't prepared. She was 19. She wasn't prepared for a baby, and she was about 26 weeks, 25 weeks into her pregnancy. I took her blood pressure. If I remember correctly, it was like 180s over 110. We're trying to calm her down because it's difficult to tell if her blood pressure is anxiety or if it has to do with the preeclampsia that we're under the assumption that she has. We're trying to get labs, we're trying to get her acclimated to the room, trying to get her comfortable with us as the staff to make sure that she is able to voice any concerns or anything that's going on with her. We're also trying to get the NICU team to come down, the OB surgeons to come in. We're trying to get her meds ordered because it's important for us to get Celestone in. We like Celestone to be given at as immediate as we can in situations like this, and then they get a second dose 24 hours later, and then they're technically what we call Celestone complete at 48 hours. So we need to buy 48 hours to help this baby to live outside the womb. The more we do, the more anxious she gets. We ended up giving her some medication to kind of calm her down because she just couldn't calm down. She couldn't understand what Nikki was trying to tell her. She couldn't understand what we were trying to tell her. When we got her into the room situated with NICU, it was important for her to be educated, first as a human being and to be taught, secondly as a mom who was going to have this child, who was going to possibly have delays, possibly not make it at 26 weeks. And it was for her to understand that. And then I think for a dad, it's not exactly real until the baby is outside of the womb. So for him to be able to offer up the support, because as worried as he was, he doesn't have the same feelings as the mom. We gave her the Celestone. We were able to take care of her blood pressure with the medication we use as nifedipine. That's what we used at the time. And we bought about 24 hours. We also had started magnesium, and magnesium makes you feel really like you had the flu. So on top of that, the anxiety that she was having, the blood pressure issues, you want to keep a calm environment. It is almost impossible to keep a calm environment with this situation.
Now, you talk about a calm environment. How can you, or how did you as her nurse, knowing that she was basically trying to kill her off the wall because she's so nervous, how did you promote like a calm, safe environment for her?
I tried to explain every single thing that we did along the way, literally as much as even just fluffing up a pillow, why we were doing it, why she was in the position that she was in, why the curtains were pulled, why we limited the people that came in to see her. We educated every single person that came in that room that they had to keep calm, that their voices had to be down. We tried not to use the overhead speakers so that it went through her room. Everything that we did was explained to her, and it was in a tone that was kind of just flat, just so she understood and nothing alarmed her. We turned down all alarms, all noises, everything that might set her off is what we did.
Okay. Now, do you think, looking back and reflecting, do you think that action, like turning down the lights and explaining everything, do you think that helped bring her back and to be able to focus?
I do, and I actually I saw her not too long after the baby was born, coming from the NICU, and she actually said that it was a huge help to her, but it was also the fact that we explained everything to her, her not knowing anything medical, her coming from teaching preschool children. She didn't know anything.
Okay, good. So Mercer talks about the stress of becoming a mother is increased when you have a young mother and a premature baby.
Mm-hmm.
Now, can you kind of go into, after the baby was born, how the mother reacted and how you helped her make that transition as her nurse?
A lot of times in preterm labor and preeclampsia, the deliveries happen very, very fast, sometimes in the bed. There's not a lot of time to prepare or to get the parents prepared that the birth is imminent, which is what happened in this case. She became fully very quickly when we took the magnesium down to a gram, and baby came out. NICU basically takes the baby and does their thing with them, and mom doesn't really see too much because the staff is blocking her view. So it's more, he's not crying, he's not crying, he's not crying. We don't want him to cry right now. We want to get the tubes in. We want to get the lines in if we can. We want to get him stabilized so you can at least touch your baby. It's a constant reassurance. You're that go-between person. Yep, I see him. He's okay. Yep, nope, they're working on him right now. Yep, his color looks okay. Because they don't understand and they can't see and they don't know what they're looking for. Once the baby is stabilized and in the incubator, based on the number of weeks or how their condition is, we tend to either we want mom to touch the baby in some way, shape, or form. So whether it be just hands on the skin through the incubator or actually holding them. In this situation, the baby had to be in the incubator and mom was able to put her hands in. NICU takes the baby and goes upstairs, and mom is kind of left with this emptiness and not really sure where she's going.
So how do you help the mother cope with that emptiness feeling of not being able to hold her baby like a normal full-term baby? The mother would have that opportunity. How do you help the mother kind of
Settle down.
settle or
we try
understand?
to keep the mom focused on task.
Mm-hmm.
So basically, okay, can we get you breastfeeding to see if that's working? Can we get you comfortable? Let's get you cleaned up. Like, everything is like job and task related, so she's got something to focus on. We try to buy ourselves an hour to 2 hours so that we can get that mom upstairs as soon as possible. While she may not be able to actually physically touch her child, she's able to be a part of the care. She's able to make decisions and listen to the reasoning and understand where this child is coming from in the situation that the doctors are in on pursuing the health of this child.
After the baby has been born in the NICU and the mother is actually finally able to visit her baby and touch and hold, what do you do as the nurse to promote like the health education or just to promote bonding for a young mother?
We get that mom up to the NICU as often as possible. We encourage the mom to breastfeed if possible, to store the milk, to do all of the normal motherly things that we all do, except for we take our children home. We encourage them to visit, to call, to be a part of all the rounds every morning, to make decisions, to talk to the doctors, to be on a first name basis with the nurses, to just be a part of all the care that they would if that baby was home and they were taking them to the pediatrician.
Leslie, thank you so much for your interesting case study and incorporating your views and experience using Ramona T. Mercer's theory of maternal role attainment. You're very knowledgeable in your description of events, and your patients are so lucky to have you. Now get back to work.